Good afternoon. My name is Trey Reckling from the Academy of Cannabis Science, and we're so happy to have you here with us today. We are welcoming Dr. Uma Dhanabalan. Dr. we're very excited to have you, and I'm going to cheat and look at my sheet because her accolades run deep. Dr. Uma is well known as Dr. Uma. She completed her Bachelor of Arts degree with high honors from Rutgers University and her medical degree from the University of Medicine and Dentistry at Newark, New Jersey. She completed her family practice residency at Medical University of South Carolina in Charleston, South Carolina. She has her master's in public health and completed her occupational and environmental medicine residency and fellowship in heavy metals at the Harvard School of Public Health in Boston, Massachusetts. She's also a fellow of the American Academy of Physicians. She's a diplomat in cannabinoid medicine, certified by the American Academy as a cannabinoid medicine and medical review officer, certified by the Medical Review Officer Certification Council. Wow, we're so excited to have you. There's no way I could have remembered all that, Dr. Uma. I could go on here. I'm going to skip a little bit, but Dr. Uma is also the founder and CEO of Global Health and Hygiene Solutions, established in 2006. As Dr. Uma says, cannabis is not for everyone, yet it should be a first-line option, not the last resort. Dr. Uma, welcome, and thank you for joining us.
Welcome, everybody. I thank you so much. And Trey, it's taken us many years to finally do this, but I'm so excited to be here.
Absolutely. So tell us a little bit more. I know I gave you an introduction, and I was commenting early on your Southern accent because we both have spent a good amount of time in South Carolina. But tell us a little bit more about you.
Well, it's interesting you talk about my accent. If people did not see my face, they would not be clear as to where I came from. I'm originally from India, and I grew up most of my life in Jersey. I came here in 1970. My parents are the reason why we came to this country, and education was the reason that made us be brought here to the United States. My parents my dad was a chemical engineer in India. My mom was a teacher, and it was because of the love of education that they brought their kids here. My brother is Dr. Shiva, who's the inventor of email, and I'm Dr. Uma, so we were very fortunate to also get the best education. And I love this country for that. At any age, at any time, you can learn from anywhere. And now with this opportunity of everything that's on the internet, you can continue to learn. But with all of my education, I never, ever, ever learned about the endocannabinoid system till about 11 years ago. And it was because of my mother that I really started to learn about this. And she saw a TV program about how cannabis was being used in Israel. And I could still hear her saying they're using ganja. And I knew what that word was. But it was fascinating to me was that she said they're using it for COPD, asthma, lung cancer, and PTS. I leave the D off, and I'll come back to that later because I call it post-traumatic stress. We're not disorders and we ain't diseases. So we need to rename a few things that are told out there. And I never got to use this plant for my mother. And it was after her death in January of 2012 that I really realized the value of me needing to speak out. And also, I was in the state of Washington. I was right there in Richland, Washington. And you talk about how life takes you completely to turn around. I was working at a federal site. I was working at the Hanford site, knowing very clearly I was testing people for THC. And if they tested positive for this chemical, they lost their jobs and many of them, their livelihoods. And today, I really feel it should not be held against you for the job that you do. And even for people to understand, as a doctor, I was told do no harm, but Dr. Uma says safety first, do no harm. That's the part that I've really been able to say boldly out there to all of my colleagues. And no other plant that can I say that about, in the sense of that here's a plant that came from my culture in India, and it was part of the Ayurvedic medicine. And to say that nobody in the whole world has ever died from a cannabis overdose.
Amen. Amen. Absolutely. So if you didn't grow up with this, although as you say it's from India, it's the OG, right? Originally, it was mentioned in the Vedas, and the first maybe one of the first published mentionings of cannabis was in India. Did you grow up with a bias against it still, like many of us? And what point was the turning point for you?
Well, I grew up in New Jersey, and I was there when I was 8 years old. And I first really got to see it probably when I was about 13 years old, where I was first exposed to it. But what I really realized was that the demonization of this plant was real. The gateway drug to all other drugs. And meanwhile, alcohol and sugar are pretty much the gateway drugs, is what we can really look at. And the other thing's really interesting is that I'm still dealing with the demonization of this plant because it is still federally illegal. I'm still doing something that I'm still scrutinized for. And also, I feel it's held against medicine. And many of my colleagues don't even know what the endocannabinoid system is. And today, I'm proud to say I am a cannabinoid medicine specialist. Yes.
And Dr. Uma, we're getting a little bit of freeze frame on your side right now, so you know. Dr. Uma, you're frozen. Let's try, if you could click stop video. Let's see if that fixes. We might have just lost you. I think we just lost her. She'll be coming right back in. I'm sorry, y'all. But we'll make sure you'll have plenty of time for questions. No worries.
Are you guys able to hear me?
There we are. We have you back. We had lost you there for just a second. And so if it continues to be problematic on the speed, I'll let you know, and we'll see. We don't want to do without your camera, but if that'll increase your speed, we'll see. But right now it's great.
Okay, great. Well, what I'm really understanding is that till about 11 years ago, I really had no incentive to talk about this plant. Mm-hmm. I worked for a federal site. I made a lot of money, and I was considered part of the normal stream of being a healthcare provider. And what I realize now is that I am a disruptive provider in this field, and I'm loving what I'm doing. And I'm very proud that we do have this plant available. It's not available everywhere. And that comes to some of the pillars of what I'm really wanting to do. I want the world to know about cannabis and the endocannabinoid system. I want the stigma to be removed, and I'm doing it through education. And I want to see legalization and also decriminalization. And they're two different things. I want to see laboratory standards. I want to see products created. I want to see that everybody in the world knows that we have an endocannabinoid system. And I think that's part of the problem. Mm-hmm. People don't understand that we have this system and how cannabis works with it. And there's so much that we still don't understand about the human body. And that's what I really want people to know. Always be curious, ask questions.
Absolutely. So what do? You mentioned your peers and you being a disruptor. So you're an outlier right now, but what do you say to your peers other physicians who just don't get it? Do you have an elevator speech to pique their interest or to try to catch their attention?
I tell them that there's a system known as the endocannabinoid system that's mere 600 million years old, and that it's evolved from a sea squirt to humans today, and that it impacts every part of our system. Would you not like to know about it? And I tell them there's 3 facts I'd like you to know. Number 1, nobody has ever died from cannabis. Number 2, it was prescribed by doctors, and it was in the United States Pharmacopoeia from 1850 to 1942, and it was used for opioid addiction, not the cause of opioid addiction. And number 3, the United States of America has the patent number 6630-507. And it states cannabinoids as an antioxidant and neuroprotectant. And it was issued to the United States of America on October 7th, 2003. So that's pretty much my elevator speech to them.
Facts, facts. So you mentioned opioid sparing. Could you talk to us a little bit? Because I know that's what's gotten a lot of people's attention, and for great reason. So talk to us about where opioids and cannabis intersect, and how we should be thinking about this.
Well, there's one of my taglines is cannabis, the exit drug. That's my registered trademark, actually. And we want to put that on every t-shirt because I've called it an exit drug. And people say, why do you call it an exit drug? And I said, because I have an exit plan. And when doctors write a prescription, there is no exit plan. There is no when are you going to get the people off those meds. We diagnose you with hypertension, diabetes, hyperlipidemia, anxiety, depression, whatever it is, there is no exit plan. And what I'm able to do, and I follow my patients. I'm not out there doling out cards. I'm not a mill that writes out certifications, and I take what I do very seriously. And I've been able to get my patients off all of their opioids, off of many, if not many of their other prescription medications. I've gotten them off of alcohol. I've gotten them off of nicotine. We've used it for weight loss. We've used it for our diabetic patients. And I do call it an exit drug also for death and dying, because I do want to see people die with dignity. And I feel it should be incorporated with hospice, with cancer patients, because the people that are left behind also suffer with PTS. And it would be nice to see that people died with a little bit of laughter and joy. And I also deal with pediatric patients. So this is where I want to see the parents and the family members have a little bit of joy, as well as to know that they did their very best. And death is part of what we all are going to face. Every one of us has, an expiration date. So I talk about death and dying also very openly with my patients.
So I know the answer to this, but could you tell everybody when's the last time you wrote an opioid prescription?
Like I said, it's probably been over 15 years. It's funny, even before I knew about cannabis, when I started to work in Brockton, Massachusetts, I used to have a nurse, and she would ask the patients, what's your medication list? And she's, Dr. Uma doesn't write those opioids, so you better find somebody else. And so it's been a long time track record of mine that I really have not believed in these opioids. And it's also very interesting is that, pain was not part of my repertoire till 1996. And pain became the fifth vital sign. And I remember the introduction of OxyContin as well. And we were instructed, if anybody had a pain scale greater than 5, make sure they walked out with 10 pills. And those pills were OxyContin.
Wow. Wow. So kudos, because I don't know how many people can say that. I know it's very, very few can say that they are not, as you say, not part of the opioid epidemic in this country anymore. Talk to us a little bit. You mentioned PTSD and you said we are not disorders. Could you explain that a little bit? And what do you mean by that?
Absolutely. I've said, Dr. Uma says, drop the D, because we like to label people, and it's just post-traumatic stress. We relate it to veterans, but it's not just veterans that suffer with post-traumatic stress. And I think now with COVID, I think all of us have a little bit of post-traumatic stress induced to us. And, we also have to understand that it's very clear, very, very clear. The science is what I'm talking about. This is not hoopla. This is backed up with science. And there's a lovely thing called PubMed, folks. Write this down. PUBMED.gov. I'm tired of hearing this crapola that we don't have enough research. Please look it up. And there's also a thing called Google. When it comes to post-traumatic stress, what we understand is that there's actual brain changes. When you look at a so-called normal brain versus somebody that has suffered from post-traumatic stress, the receptors, which come to the CB1 receptors, why cannabis works, cannabinoid receptors, what we understand is it's very depleted, and why cannabis works so beautifully with patients that are diagnosed with post-traumatic stress. And we label it as diseases and disorders. And I really want to get away from that terms and understand that no matter who you are or where you are, that we can all deal with these issues and illnesses. But to be labeled, the only reason for those labels, honestly, is to have an ICD-9 or 10 code so we can bill it. So we could come up, doctors come up, I call it with the triple D. We come up with a diagnosis, we come up with a drug and a dose.
Mm-hmm.
And then we adjust those drugs or the dosages. And then if you have a complication, we throw another drug into it.
No, and I hear you, and thank you for your insight on PTS, as you say. This was the first time. Today is the first time I've ever heard anybody say that, and it makes all the sense in the world. And so I hope we'll hear it from other people as well. So as a physician, I have to ask you, and I imagine other people ask you too. But what about the harm, Dr. Uma? What for all the good that cannabis can do, is there not potential for harm, and what concerns might you have for somebody who uses cannabis?
Absolutely. When you read my introduction, I said to you, cannabis is not for everybody. And I want to make that clear. It's not for everybody. Yet, and this is the big yet part, I do believe it should be a first line option and not the last resort. By the time people get to me, they've got orifices created, they've had surgeries done, they've even had parts of their brain removed. I mean, I can't tell you the state of affairs that I see it in. As far as harm goes, I really believe that, there are people that we understand metabolisms don't work, how the drug interacts with them and how it can interact with other drugs that they have to be on. So the harm that I worry about is there's a disease known as addiction, and that's a real disease. So if people have this disease known as addiction, they can get addicted to anything.
Mm-hmm.
And overuse of anything can be harmful. So that's where I talk about harm. And safety first, do no harm. And this is where I talk about impairment versus having a drug test positive. Just because you test positive for a drug does not mean that you're impaired. And just because you test negative for a drug does not mean that you're not impaired. And I want to get that clear to people. Very clear and loud, because that's the other message. I'm a medical review officer. As a medical review officer, we do drug testing, hair testing, saliva testing, urine testing, whatever the testing is. If you test positive, there's two types of drug tests if you work for a federal site or a non-federal drug testing. And this is where, because cannabis is still federally illegal, if you work for a federal site, THC is still held as being illegal. And so this is where you have to know your rules and regulations of what you're dealing with. So that belongs to the safety issue. Mm-hmm. So this is where, if you're in a safety sensitive job, they say, well, what can happen to you? And meanwhile, people are high as a kite, even on their blood pressure medications or their diabetic medications. If you've got somebody with high blood pressure and their blood pressure makes them drop them down, that's a safety issue. That could be harmful. If your blood sugar is high and your blood sugar drops, that's a safety issue. So I want people to understand, what does safety mean? What does impairment mean? What does intoxication mean? And what does drug testing mean? Different things and different categories that we need to address it with when we talk about safety and harm.
Absolutely. And we know the war on drugs and the very narrow scope of that discussion has brought a lot of harm, a lot of ignorance, and a great deal of misunderstanding. So we have 70 odd years of undoing to do too. And hopefully, the train is on the way and more people will learn. And as we've talked, there's a great need even for children to begin to understand that I have an endocannabinoid system. That's just like I have a pulmonary system or a circulatory system. And it's not part of the language yet, but we have great hopes that it will be. I want to make sure to ask people on the call today for give them an opportunity to ask questions. So I want to call it out. Anybody have a question for Dr. Uma? Because you know me, I will have plenty.
I
Anyone?
have a few questions for people.
Okay.
Okay.
Have you been able to discuss cannabis with your doctors? And if so, how do they treat you?
Great question.
Fortunately, in my experience, I was able, thank you so much, Trey, and thank you, Doctor. Please say your name one more time for me. I'm so
I
sorry.
go by Dr. Uma, and my last name
Dr.
is
Uma,
Dhanabalan.
I'm so thankful to be on this call with you both. And so I'm over here holding my heart. I'm just so thankful to be here with you. So I had a breast cancer diagnosis over 7 years ago, and I'm so fortunate that my oncologist was completely open to hearing about me using cannabis, because I struggled when I thought about the traditional treatment option, because my mother also had breast cancer and unfortunately she passed. And if I would have known to go and grab my stepdad's stash from behind the furnace on the side and give to my mother. So I am a trailblazer for decriminalizing cannabis. And I'm so thankful for you sharing your story. And Trey, thank you so much. So yes, for my experience.
Thank you.
And you know, when you said cancer, that's where I really believe such an integral part, and I can't bring this together. When I hear that word cancer, cannabis must be, it must be an integral part, because there is so much data. And I did research from the time probably I was 13 or 14 years old. I've been a lab rat. I've worked with lab rats. I worked with mice. I worked with tissue culture. I worked with humans. I worked on all different levels. And I worked with the same drugs that we're using today. And when we think about cancer, I call it the party pack of five that we talk about. We do chemotherapy, we do radiation, we do immunotherapy, we do antibiotics and steroids, or we whack parts of the body off. That's our treatment plan. And I'm like, look, there's 4 very clear, specific properties I want people to know when it comes to cancer. Please write down these 4 properties. Number 1, it targets the cancer cells and does not let the cancer cells multiply. Anti-proliferation. Fact number 2, it does not let the cancer cells spread. Anti-metastatic. Fact number 3, it cuts off the blood supply to the cancer cells. Anti-agenesis. And fact number 4, it causes what's called apoptosis. Fancy term for cell death. And what we're also learning, and this is a very important fact, is that with childhood cancers, what they call poorly differentiated and highly differentiated. When a cell is highly differentiated, it means it's got the potential to change and go to different other places. It makes it kind of age them. So it makes it poorly differentiated. So these are all different solid science mechanisms. And so the facts are out there, folks. Please, please, I beg people, open your hearts. You don't have to use this medicine, but you know somebody that can benefit from it. Open your minds, because we all have an endocannabinoid system. And as clinicians and people, this will allow people to open their doors to a better doctor-patient relationship.
Absolutely. And I think it's threatening to some physicians who feel like, well, it's kind of, if this is true, it's pulling the rug from underneath me. But from your perspective, no, it's a much better tool in the toolkit, so to speak, and at least something, as you said, that should be considered first and not last. I'm sure it's very frustrating to have patients who come to you who are taking a handful of pills every day and don't know if the symptoms are from the original complaint or from the pills. So thank you much. And I want to ask other questions.
Yes, this is Mary speaking. I'm wondering about psychosis, people that have mental illness and marijuana.
Thank you very much for asking that question, because honestly, this is where, there's been always this concept that it leads to schizophrenia. And our late Dr. Lester Grinspoon had a beautiful thing. He said, if schizophrenia is 1% in the population, and we've got 60% of the population using cannabis, why aren't we seeing 60% of the people with schizophrenia then? Okay, so this is my thing, my answer to them. And like I say, it's not for everybody. And I've seen people where, you know, overconsumption or drug interactions can feel like they're overwhelming, and it creates anxiety. And just as much, there's also the underlying things. And this is why Dr. Uma has 3 basic rules. There's 3 rules I tell my patients when you're using cannabis. Rule number 1, you must hydrate. Hydration is key. People just don't drink enough fluids to begin with. Okay, and if you're not hydrated, cannabis is a dehydrant. And if you get dehydrated, that's going to put you in a state of anxiety also. And that can lead down a wrong path. The other thing that happens is cannabis, it causes your blood sugar to drop. So if your blood sugar gets low, that's going to make you feel anxious. And if anybody's not even using cannabis and your blood sugar is low, you know how you literally feel like you're losing your mind. So you need to be aware of these things when you use cannabis, what you do to prevent some of these things. And then rule number 3 is write it down, because you don't remember everything. And every time you get it, it's not the same thing. I don't care if it's Mama Kush, Baba Kush, or whatever Kush it is. And even if it's the same name, it's not the same profile every time. And I do have patients where it does make them anxious, and it does make them feel like they're losing their mind, and people will report it. But honestly, I see, when I look at the risks and the benefits, it's actually helping those psychotic patients to have some normalization and be off of their many pills that they're on. But again, it's not for everybody.
No, and people in our class will recognize, like you talked about being dehydrated. People in some of our classes will recognize the word xerostomia. And, you know, the joke was always cannabis causes dry mouth, but our dentists are concerned because a drier mouth can lead to more cavities. So again, just like David's doing now, hydrate, hydrate, hydrate. Absolutely.
Well, there's a slogan. It's a Dr. Uma says, it's hydrate before you medicate. That's rule number 1. Oh. We actually have that as another slogan. So these are the kind of messages that we want people to understand. It's not just about cannabis I'm talking about, folks. This is about the one body that you got, life. And that's how I explain the endocannabinoid system. I explain it in one word to my colleagues, life, and we were not taught about it. And in the words of Dr. Damaso, he states that the endocannabinoid system is meant for us to relax, eat, sleep, forget, and protect. And if we look at these 5 words, if any one of these things is not at homeostasis, we are at dis-ease. We are not at ease. We are at dis-ease. And I explain these 5 words in a way of how people can understand it. If your muscle is twitching or your brain is twitching, we're talking about seizures. If your muscle just doesn't move, we're talking about ALS. If you eat too much, obesity. If you don't eat enough, anorexia. If you sleep too much, depression. If you don't sleep enough, insomnia. If you forget too much, Alzheimer's, dementia. If you don't forget, PTS. And this is where we talk about how we need people to forget. Forgetting is equally as important as remembering. Women, if you guys remember childbirth, you think you're ever going to get laid again? Men, forget about it. So it's equally important. I say it jokingly, but honestly, we need to forget about certain things as much as we want to remember. As far as protection, overprotection is autoimmune diseases. Lupus, MS, these are all examples of autoimmune. Under protection, you're immunocompromised. And I want to talk about that as far as COVID goes. COVID was a perfect example of cytokine storm. We heard this word over and over and over again out there. Cytokines are what our body reacts to when we have some type of trauma. That trauma, we have to have inflammation or no inflammation. This is this ease again, folks, ease. If you remember the endocannabinoid system, that E word is about ease, okay? And if we're not at ease, we are at dis-ease, okay? And what happened was people were having an overreaction to this virus, and that's why the body overreacted. And honestly, it was because many people were having comorbidities, hypertension, diabetes. They were on cholesterol medications, other medications. And that's one thing that's very important. Cannabis can interact with other drugs. And when we talk about other drugs, we are not talking enough about alcohol. People use alcohol in our society, and doctors ask you, how many drinks do you have? But they're not telling you, you have no damn business mixing alcohol with certain drugs. And I'm going to say it boldly out there. If you are depressed or feeling anxious, please stay away from the alcohol. It's a depressant. It's a dehydrant. It kills your brain cells. It interacts with drugs, and there is no alcohol deficiency. Cannabis, it is a dehydrant. It protects your brain, and there is cannabinoid deficiencies, and Dr. Ethan Russo has talked about that. It protects your brain, and it treats depression, and it won't kill you.
Boy, I think there are a lot of people on the call wishing you were their doctor. I
I
know.
am their doctor. I'm right here for you.
I know. I wish I had had the opportunity to hear this from my physician years ago. And so it gives me hope. And as Sean points out, you describe it so clearly. As Sean points out, it's like we're talking Maslow's hierarchy of needs, but when it comes to human health. And it just makes a lot of sense. Mary White, did you have a question?
Yeah, well, a couple of things. First of all, nice to see you, doctor. You're very cool. I teach cooking with cannabis classes here in Seattle, and I'm often trying to explain the ECS to people. And, you know, I'm not a sciencey person. I'm a freaking cook, right? So I'm up here going, well, you know, mammals have it and it's regulatory. So thank you for this, because that really helps. But what I also share with them is that my cat was 2.5 years ago diagnosed with cancer, and they gave him 2 weeks to live. And he's my baby. So I'm like, no. So I make, you know, tincture and everything. So I gave him 3 times a day. I just said, fuck it, I'm doing it. But 3 times a day, I gave him the tincture, and he's fine. He's, you know, no cancer and no allergies. But when I tell people that, they look at me like a crazy cat lady. So how do I, you know what I mean?
I'll explain it to you. So, you know, we talk about the endocannabinoid system, and I said to you, it's evolved from the sea squirt to humans today. And I gave the first veterinary conference lecture in Canada, and I remember getting the call from somebody, and I said, you know, I'm not a veterinary doctor. They go, we know that, Dr. Uma. We know that, but you are here explaining it to people and how animals have this system and why all mammals have this system. And this is why it works for our animals to our humans. And we can understand it's about inflammation, everything. And we give it fancy words and fancy diagnosis, right? If your skin's inflamed, we call it dermatitis, arthritis, bursitis, gastritis, appendicitis, it's itis. And your cat had an inflammation, and you treated it with something that they could take in. And you talked about something that's very interesting. You said, I made it and I gave tinctures. So this is a perfect segue into how do we deliver this to people? Mm-hmm. And there again, I tell people there's not one size fits all. It depends on you. It's all about you. And that's what's beautiful about the endocannabinoid system and using cannabis. It's truly personalized medicine. And you mentioned food. So one of my other quotes is cannabis is food and medicine. And I talk about, to me, food is medicine. And people forget about cannabis for a moment. If you think about your food, you daggone well better know where your food is coming from. Learn to read the label. Was the animal that you're eating fed corn? or was it grass-fed? Because if the animal is inflamed, you will be inflamed.
Yeah.
And so for our animals, if our animals are eating corn product meals, they're going to be inflamed. And then you wonder why our animals are getting the same illnesses as humans and cancers, all of the things that we're seeing. And what's really fascinating about this plant also, if you look at this, is this plant is probably one of the oldest agricultural crops, over 12,000 years now. And it is food, fuel, fiber, paper, and medicine. And Dr. Uma says this plant is for people, pets, the planet, for peace, and for profit. And your profit is your health and wellness.
I like that. That's very good.
I like
you.
that too.
Thank
May I ask you, there's an awful lot of buzz, no pun intended, right now about plant medicine. And cannabis is a plant medicine, but then also people are pointing to psilocybin medicine and ayahuasca. And, you know, there's just a lot that's part of the conversation suddenly. And it's not in the Timothy Leary carnival kind of environment, but it's a lot more medical approach this time. Have you spoken publicly or taken a position about that direction medically?
Absolutely, because at the end of the day, we don't know everything. Let's start there by saying that. I can boldly say it. I have no shame in saying it. I don't know everything, but what I do know, I'm happily sharing out there, but there's much more to learn. And I come from a culture where my grandmother didn't read and write. She was a shaman. She looked at you, she went out there, picked out the plants, came up with a concoction, she rubbed it on you, she poured it on you, she rubbed it on, you know, whatever it was. We have much to learn, folks. And I really want people to understand, please, we need to look at not just cannabis, we need to look at our food, we need to look at the soil, we need to look at all of these things that are out there. And this is why I love the endocannabinoid system, because what we're realizing is if we understand that there's a system and how these different things work with it, then we can look at other things, be it ayahuasca, be it psilocybin, be it whatever it may be. And I also come from a culture where we have different spices. All of these spices are now being studied. Antimicrobial, antibacterial, antiviral, whatever it is. We're understanding how this can be used. The other thing about cannabis is what's really important. It's a fat food. So we're learning about fat metabolism and carbohydrate metabolism and how all of this fits in with the endocannabinoid system. The CB1, primarily in the brain, CB2, primarily in the immune system. Well, we got a whole bunch of stuff going on all over. And THC, well studied, works with CB1 and CB2. CBD does not work. I want to make that clear. Does not work directly with the CB1 and CB2. It works in a different mechanism. And that's why I want to see this plant kept in its whole. Please, I beg of people of that. Otherwise, we're going to have this separated out into 150 pills. Pharmaceutical companies are already trying to do that and study it. And they've already been doing it. I mean, Marinol has been around before we even discussed cannabis. And now Epidiolex is out there and Sativax and all these other drugs. But we're studying one molecule at a time, and that scares the kahootsies out of me.
No, I'm with you. It's like everybody wants to do the fancy deconstructed meal when the plant has for millions of years perfected itself, and you know, in our arrogance, we want to deconstruct it and decide what's best. So yeah, with you on that, absolutely.
And that's the other thing in the medical field that we've done is, you know, you go to your cardiologist and you go to your rheumatologist and you go to your psychiatrist, and I'm an old school family doctor. That's where my foundation comes from. Thanks to MESC, that's where, you know, I did my training, but my curiosity also came from there. And there's 3 modes I want to talk about. Treatment, which is where we always go to as far as drugs, but I'm really wanting people to understand about maintenance, and the key word that I am very passionate about is prevention. How do we prevent things from happening?
Absolutely, and thank you for that. I was looking, I thought somebody had their hand up. Anyone?
Hey, I have a question.
David?
Somebody,
Actually, I have a question about hydration.
David,
real
hold on
quick.
one second. I think we had Heather there.
Sorry.
Somebody's got
Okay,
some background noise.
I'll go ahead and ask.
Okay.
Thank you, Dr. Uma, for explaining what you know about cannabis.
I think somebody has to mute
Can I
their
get a
microphone.
small gluten-free pizza? Sure. Okay.
There we go.
Okay.
Okay.
Sorry about that.
No. Thank you for explaining what you know about cannabis as an exit drug. And I'm wondering what you think about, or how can we apply cannabis to the opioid crisis on a broader scale? Does that look like empowering doctors, or what would you like?
Well, first of all, there's enough research out there. Number one, if we can make it accessible, it's not just having medical laws, we need to make it accessible.
Mm-hmm.
So that's the first thing, is not just coming up with the laws, making sure that you have the accessibility, and definitely we need doctors to be taught about the endocannabinoid system. And that's why my hashtag is educate, embrace, and empower. We need to educate people, and we need to embrace this as an option. It's out there, and we need to let people that you can use this to be empowered. And why not?
Thank you.
David, I'm sorry, we had you started and we cut you off.
No worries, no worries. I was super relieved, and thank you, Dr. Uma and Trey, for this amazing Saturday sesh. I was super relieved to find out you're talking about how cannabis is a dehydrant. It's something that I don't ever come across anybody else talking about. And so my question is regarding to hydration. I've noticed I'm a medical user, solventless rosin, so cannabis oil. So I'm always hydrating an extra lot because it seems to be even more dehydrated than just flour. But what could I do to try and stay on top of hydration besides just drinking a whole ton loads of warm water? It's kind of a trying thing for me because I have eczema after my burn pit exposure in the war. And so I'm just trying to stay ahead of the hydrant game. So if you had any suggestions in that as a medical user.
Absolutely. So this is where I want to make people understand, this is one of the few things that I talk about. Overconsumption of water can kill people too. So I want people, this is a warning. You need to know where your numbers are. So I don't want people going to town. I don't have to worry about that with cannabis, but I do have to worry about that with water. So I want to make people aware of certain medical conditions that people have to be careful of. So for the most part, and this is again, general population. So please check with your numbers. And if you have questions, you can always call and we do consults. But I tell people you should be at least peeing 5 times a day. That's the general rule of thumb, is 5 to 6 times a day you should be peeing. And your urine should be clear. Okay, now there's odors, and we should have a whole conversation about urine, pee, and poop. We can have a conversation about it. But for the most part, the urine should be clear. Of course, it can have colors depending on the foods that you consume. It can also depend on the vitamins and different supplements. Different things can give the urine a color, and also odors. Some people will notice if they consume asparagus that their odors, and some people can smell it and some people don't smell it. That's another genetic thing that they've learned about too. But what we know is that when we talk about hydration, that's your kidney. Okay, and this is a very important part of making sure that you're well hydrated, because that's the system that you want to flush out. And you mentioned rosins and solvents, and that's a big concern to me. And that's, if somebody says, what are the things that I'm very concerned about, and is what is left in our weed? What's the residual?
Solventless.
Yes. But if that's one of the things, since you mentioned that you're solventless, I want people to be aware of the people that are using solvents and what's left behind, and why we want testing. And I want to see testing done, because this is where we want to make sure that there's no heavy metals, because that's one of the things that I've studied well. What we know of, even the smallest amount over time accumulates. Same with solvents, over time can have negative effects. But to answer your question, we want people hydrating, peeing 5 to 6 times. Please look at the color of your urine. You can even, I recommend people getting annual testing done, and getting your urine tested so you know what your specific gravity is and what the concentrations, and you should know what your BUN and creatinine, and that goes into the function of your kidneys. And much more detail than I probably wanted to hear right now, but I'm very proud of you that you figured your body ain't earned for the water already. And I always add a little lemon or lime actually, and a couple of drops of apple cider vinegar. I'm all about alkalization as well. As you alkalize, that also removes residual sediments in your body.
That'd be good for, like, that's probably prevention of kidney stones even, or something like that.
Oh my God. So let's talk about that, because one of the things that was indicated for cannabis from the get-go was gout. And gout is nothing but a unease of your uric acid, right? Gout is buildup of uric acid or not enough elimination of uric acid. So this is where crystals and joint pains, and definitely I see an improvement with my patients that have gout and all types of kidney stones as well.
That's great.
Thank you,
David,
doctor.
thanks for a lead-off question that brought us all kind of information. That's excellent. And we're running real close to time, but Robert, you had your hand up, so I want to make sure to ask you for your question.
Hi, yes, my name is Robert Jeffrey. Hi, Dr. Uma.
Hey, Rob, how are you?
Not too bad. I joined on, so I want to bring this back real quick to 2 statements ago about the opioid crisis. I would like to give part of an answer to that question in this regard. I come from a background of a 20-year habit. Dr. Uma is my doctor. About 5-6 years ago, I had a little over 6 years ago, I had my 5th massive heart attack. I was given 2 years left to live before I hit 30. I'm now 35 and I live a healthy life. The opioids, my doctors just kept wanting to give pills. From behind me, it's all cannabis. That's all I take from now on. I go to Dr. Uma. She is my doctor, and I am even a caregiver out of state now to help patients fight this opioid epidemic, because drugs are not there. The endocannabinoid system, if you give it the right amount of CBD, the right amount of CBN, CBG, THC, it lights up and it does amazing things for your body. So I just wanted to add that, and thank you for these shows on Saturdays, Dr. Uma. We appreciate them.
Thank you.
Robert, thank you so much for sharing and for the testimonial. You know, some people, it's just numbers. And so sometimes people have to understand the passion and how it's really impacts individuals' lives on a grand scale. Dr. Uma, thank you. This has been great. I've always learned stuff doing this, but today I just feel like I need to go back and watch this again. And you all can watch this again because we're recording today. We'll post it to our YouTube page. Remember, #educate, embrace, and empower. Dr. Uma is also, Dr. Uma, do you mind plugging about your new writing venture coming up?
Oh, yes, absolutely. So first of all, I wanted to let people know, number one, I'm here for you and your family. I do all ages. We're here for consults at upliftinghealthandwellness.com. Contact us. You can make appointments. And I'm very, very excited because there's a relaunch of a magazine known as the American Journal of Endocannabinoid Medicine. And I'm going to be writing a column in it called Providers, Patients, and Possibilities. Because at the end of the day, this is what I tell all my colleagues, you know, every patient is not a healthcare provider, but every healthcare provider is a patient. So that's one of the messages I want to send out to everybody. And we are here understanding that I don't know everything, but I'm here to tell you what I do know. And I'm here to share as much information. And I have no shame in telling you if I don't know something, we're going to learn about it together. And that's what it's all about. And we're also planning to start a podcast, which we're trying to get together, and we'd love your help on all of this. And I have a clear message which says, reach 1, teach 10, teach 1, reach 10. And these are all the philosophies that I truly believe in. I truly love what I'm doing. And each of you are very, very special to me. My voice is being heard all over the world. I was traveling up until now. Literally, we traveled to Thailand. We've traveled to Colombia. We've been to Jamaica. But I truly believe out of COVID, our voices can be heard everywhere now. I mean, that's the beauty of this. And Trey, I thank you very much for today. I thank each of you that are out there. You are the messengers, not just for you, but for the future. And we all are leaving a legacy behind by taking care of our own health and wellness. And I also say, you know, one healthy person can help 4 other people. One sick person needs 4 other people. So on that note, I say I love you all. Thank you. God bless.
Thank you so much. And thank you all for joining us here for Saturday Sesh. We'll be back the first Saturday of next month with our next installment with our guest to be announced. And thank you all. Dr. Uma, thank you so much and have a wonderful day.